In this recording, we are going to go over the medical documentation forms. There has been a new update to the medical documentation forms in the summer of 2022. So this video or recording is going to go over the new form and all the details on that. So let's see. Oops, here we go. All right, so the first slide is going to be an example of what the new medical documentation form looks like. And it has many of the same components that the old forms have had, if those are what you were using in the past. The goal was just to streamline it and make it a little bit easier to use for doctors' offices and WIC staff. We need a medical documentation form if we're going to issue an exempt formula. There is a video about the different kinds of benefits and formula if you're interested in seeing what the exempt formulas were. And the medical documentation form is not only a New York State requirement, but a federal requirement. So this document must be fully and correctly completed to issue formulas, to issue exempt formulas or contract formulas to participants over the age of 1. We would also need it to issue nutrition supplements like Boost or Pediasure or Ensure, those types of things to children over the age of 1 or our adult participants, so prenatal or postpartum women. And per state policy, we're required to follow up on the medical documentation forms daily until the participant scenario is resolved. So if we receive a medical documentation form from your office and it's missing some of the information we need, the state has directed us that we need to follow up with you each business day until we receive the completed form to be able to issue the benefits to the participant. So Section A has stayed the same. It's just the participant's or patient's name and their date of birth. And this would be the name that would appear on the birth certificate. So we can't accept this document if the information is missing or incorrect. And we can't accept things. Sometimes we get forms when maybe babies are little and it might have mom's last name and baby has a different last name. So we do need the name that is like the baby's legal name or the patient as an older child or a woman. Section B talks a lot about the details as far as what you're requesting. So it needs to be filled out by the healthcare provider. It determines the type of formula, how much formula, and how long it should be issued. The monthly maximums of formulas is determined by New York State Department of Health. So we can see the formula or supplement being requested can just be written in terms of what you're looking for. And the formulary is going to be a document that shows you what different kinds of formula or supplements that WIC is able to provide based on the contracts they have. The form of the supplement being requested, so if it's powder, ready to use, or concentrate, and then the prescribed amount in ounces per day. So there is an option to provide like 20 to 32 ounces a day. You can just check that off, and that would provide the monthly maximum of what WIC can provide for all of the different formulas or supplements being requested. You can also write in a number of ounces if that was what you preferred, and then we would calculate the appropriate number of cans to issue based on reconstitution rates. So we do it by 30 days and we divide by the reconstitution rate for whatever the formula or supplement is, and that shows us how much to issue to the participant. If it's over the monthly maximum, we cannot go over that. So we'll let your office know if we're not able to issue as much as what you're recommending. Sometimes participants can get that through another means, and that would be something we would discuss with you. And then the next section is length of use. So you can choose a specific number of months. You can choose until like the baby is 1 year old if you're requesting a specific formula. You can choose 12 months. And a new medical documentation form is needed at the end of every certification per New York State policy. So even if you chose 12 months, if the person needs to certify in the next 3 months, we would still need a new form for that future certification. So we would be asking for one even though it's in a shorter amount of time than what was indicated on the form. And then that new form would cover for the next certification period for the participant. And then Section B also includes the qualifying medical conditions which are required by New York State policy. And the following options are already listed on the form, but these are not all inclusive. There is an option where you can write in other, and you just have to specify what other qualifying condition you're listing. So what's listed is developmental delays, dysphagia, failure to thrive, gastrointestinal diseases, immune system disorders, premature birth, malabsorption disorders, metabolic disorders, low birth weight, severe food allergies. And it's important to note that we can't accept written in other options such as dermatitis, rash, formula or food intolerance, fussiness, gas, spitting up, constipation, diarrhea, vomiting, colic, or being underweight or overweight. We would need to send the medical documentation back to the doctor for an alternative qualifying condition, or it would be denied if any of the not acceptable conditions were listed. And WIC nutritionists will check to make sure the qualifying medical conditions make sense with the formula that is requested. So, for example, if you were to prescribe a milk-based formula to a baby that has severe food allergies for milk, we would reach back out to you and ask if you were looking for a different type of formula, maybe a hypoallergenic formula or something like that. And now this is an update. So Section C is only required if a participant has food restrictions. If you leave it blank, the qualified nutritionist or the nutritionist will determine if supplemental food should be issued or not be issued based on the conversation with the parent or guardian. So in Section C now, it just has the boxes you could check if you want to restrict the foods, and it has infant 6 to 11 months where solids are not allowed, provide formula only, infant cereal is not allowed, or the baby food, fruits and vegetables is not allowed. And then for children older than 12 months and women, you can also choose that solids are not allowed, provide infant fruits and vegetables and infant cereal. Solids are not allowed, provide the nutritional supplement or formula being requested only, or to choose a specific food to not have on the check. So dairy food, fish, eggs, peanut butter, soy milk or tofu, or if there's something else that you want to write in, you can write that in too. If this section is not completed, then they would be open to receiving whatever makes sense for them on the food package based on the nutrition assessment done with the nutritionist. And then Section D is for the healthcare provider to complete. So for this, the provider information must be filled in, including a signature and also the date that the medical documentation form was filled out, because the date on the form is going to determine the expiration date for us. So if you put July 29th, 2022, and you chose 12 months, then that would take us to July 29th, 2023, unless of course there's an end of a certification at some point in there, which we would be requesting something sooner than that 12 months indicated for the length of use. So this is an example of what that section looks like. You can put the provider stamp, but the actual signature date and information is very important, especially so we can contact the office again in case we have any questions. So the phone number or fax number. Section E is the release of information. So this just shows if a participant or patient has signed to discuss and disclose information regarding feeding needs between the healthcare provider and the New York State WIC agency. The way that we've been working with COVID regulations, we've been doing the majority of our services remotely. So a lot of times we're getting a verbal release from patients. You might have them fill out the form with them at the office, and they might sign that with you, and then you send it over to us. But we would indicate if we've received the verbal release of information if we don't have the signature when we send you a fax or reach out to you. And then Section F is going to be filled out by WIC staff only, and that's what we use when we're confirming if a medical documentation form has been approved or not approved. So hopefully the updates to the medical documentation form make it easier to use, and you're able to reach out to us with any questions that you have. So our contact information is right on here. You can give us a call at our phone number. We have a texting line. Both of our fax numbers are listed, and we also have an email address if that works better for your office. So thank you for watching our presentation, and reach out to us with any questions.